Going in for a mammogram, learning how to keep your cholesterol in check, and understanding your blood pressure all represent basic health care. And yet what we might call basic and easily accessible are anything but for some individuals with disabilities. There are a number of gaps and barriers to health care impacting the long-term health of some in our community. Joining me to make these disparities known, plus discuss measures to eliminate barriers to care, is Susan Hetherington, Associate Professor and Director of the Strong Center for Developmental Disabilities at the University of Rochester, and J.D. Flores, a Self-Advocacy Discipline Coordinator with the University of Rochester LEND program. And welcome to you both, and I appreciate you being here today.
Thank you.
Susan, when we hear the term health disparities, talk about what are we discussing in particular in the context of issues impacting individuals with disabilities?
Well, you talked about some of them in your introduction. We know that people with disabilities in general are 5 times more likely to be diabetic, are 3 to 4 times more likely to have cardiovascular disease. There's more obesity, less activity. It's a very complicated, complex issue because there are so many reasons.
Talk a little bit about, healthcare. This is a topic of conversation in a big way in our country, and yet we don't hear these conversations about health disparities impacting people with disabilities, considering the fact that they make up the largest minority population in the U.S. So, J.D., why are we not hearing enough about this?
In my humble opinion, I can't speak for anybody else. I can speak for myself. I think we're still working, people with disabilities are working on achieving personhood. I don't think people view us as people yet because healthcare is something that's supposed to be for everyone. Even hospitals are supposed to be universal. But when you go into these places, they're not necessarily accessible. The providers aren't necessarily prepared to treat you. We're not even taught as a general, part of general education, we're electives. So if you want to study the population of people with disabilities, it's an elective. It has to be a choice of yours to be interested in that. So the fact that it's a choice means it's a choice for you to treat me. It's a choice for you to see me as a provider. So until we achieve personhood, I don't think people are going to see us or view us. I think that at large, that's the problem. And then part of it is we don't have expendable wage. We struggle to get employed. So we also don't have these private insurers. So if a provider chooses not to see a person with Medicaid insurance, then I just don't get to see that person, which is also why we struggle with dentistry, which is why folks don't get to see dentists. And so they lose their teeth or they have these huge surgeries 4 or 5 times in their lives to, address things that could have been, if they had preventative care, it wouldn't have been a worst case scenario. So, it's a laundry list of reasons, but to me, that would be the biggest.
If I could add to that, you may know that people with disabilities in Rochester are the poorest people with disabilities of any urban area in the country. So if you're poor, then your access to health care is significantly affected. We also, as J.D. mentioned, providers are not prepared. They don't have the education, especially in the adult world. Specialists don't know how to work with people with disabilities. And another area, and J.D. has worked with us on this, is health literacy, that people with disabilities are not, perhaps because they're not being treated as people, are not taught the health literacy skills that we all need to be healthy people.
J.D., tell me a little bit about your experience. What has your experience been like to seek care, to seek, doctoral support, whatever the case may be? Talk a little bit about your health journey.
So as a child, it's easier because people with disabilities are cute as children. Everyone loves us then. Everyone has some sort of, They all want to care for us. They all want to provide all these things. But when you hit 18, you kind of age out. And what they call it is you fall off the medical cliff because you no longer have a medical home. So from 18, I'll say, to at least, I'm 28 right now, so 18 to 26, I was emergency room surfing because I couldn't find a provider that would work for me. So I would go to a clinic. The clinic would be inaccessible, so I just wouldn't return. I just would go for one appointment, get just like the welcome visit, and then after that, I just knew it wouldn't work for me. So the older you get, in my experience, the older you get, the less touches you receive as an adult. So the doctors weren't physically touching me. They would just look at me and guess and kind of check as to what was wrong, what I might need. So I was like, all right, well, I can't do this. You know, this isn't working for me. You're not really serving a purpose to me. So after a while, I just stopped going, and if things got really bad, because that was the only time I sought care was when things were at the worst, it would be to emergency room. So I would just go to one emergency room after the next, just hoping to remediate whatever issue it was. But then I hit my wheelchair. You need to have a doctor on file in order to get your wheelchair fixed or new wheelchair. And so that was the stage that I was at. And so they refused to fix my chair unless I had a doctor on file. So then I had to find a clinic. I had to find a doctor because at the time my wheelchair's name was Bonnie. Bonnie needed to be fixed, so I needed to keep Bonnie going. Yeah. So I joined a random clinic, and he actually gave me a physical prescription. And it was like, no, this isn't how this process goes. This isn't, you don't hand me anything. Like, you know, the doctor's office speaks to the wheelchair company, and they work out things together. So I got lucky. We have the Complex Care Center here in Rochester, and I was on their advisory board. So I just pure luck to be on their advisory board, and I was able to get into the clinic. And the Complex Care Center is made specifically for folks with disabilities. So the rooms are bigger. They have a scale that weighs you in your chair, and it's pretty much a one-stop shop. And so I got lucky from being on their board that I was able to they have a waiting list, but I was able to kind of slide in. And so from there which was right on time, because Bonnie actually died a month later. So I was able to get a new wheelchair and have a doctor on file to make that happen. But prior to that, I could have been dying and wouldn't have known it.
And had you not been on that board, the chances of getting in when you needed to.
Very slim.
Research from Oregon Health and Science University, they found that healthcare providers gather more information on pain, depression, stress, work, hobbies, etc. for patients with disabilities and collect less information about smoking, blood pressure, some of these things we're talking about, Susan, cholesterol, mammograms, and sexual activity, and more. Talk about, first of all, what are the consequences of not focusing in on some of these basic and primary and preventive care measures? What are the consequences of not doing that?
Well, I was just given this statistic that women with intellectual and developmental disabilities, labor and delivery costs are, I have to look, 50% more expensive than those without disabilities. And why is that? So many of the things we've been talking about, lack of prenatal care, inability to get on an examining table. Think of that. You have a baby, if your obstetrician doesn't have a table that you can get on, then are you likely to go back? And then, of course, we've talked about poverty. We've talked about the other health problems, smoking, lack of activity. So all of these prenatal activities or issues lead to far more expensive health care.
And how can the medical community take more ownership of its role and ensuring that healthcare professionals are adequately educated and trained to help to prevent these barriers and these issues that are taking place?
I mean, there's a lot. So one, it would have to be in just the physical design of an actual hospital, and just in the design of curriculum, and the design of how med students are trained and built up to be actual doctors. Like, that has to change. Also, when we look at how we're treating people, and when we look at how different things, so like the opioid crisis is a major thing, right, in this country. But pain is also a high thing that happens for people with disabilities. So now, because the opioid crisis is happening, I have to pay for the consequences of someone else's decisions, because the way my pain management is happening has to be different, because the rest of the world is living in the opioid crisis. So we have to understand that, like, my cohort of folks is different than the cohort of mainstream America, just because we were already othered, right? So I don't have any like statistics to tell you this, but what I can tell you from what I've lived, in my personal opinion, is we have to be conscious that our thinking of how the world is working and how everyone else is living is a little different for me. And so we have to prepare for it to be a little different, but at the same time, you know? So I should be able to go into any hospital and not have to worry about that I should have brought someone with me, because how am I gonna get on the bed? How am I gonna get, you know, if I need an MRI, how is that gonna work for me? Or if so I had a spinal tap. I had a migraine for 3 weeks. And so no one knew what was happening. So I had to have a spinal tap. And so the fact that I have scars on my body from different surgeries, so the doctor was ill-prepared onto how to do this. Now, this is a scary thing for anyone. So, like, if you scared and you telling me you scared, how am I gonna trust you? How does that work? So we need to change the way med students are trained up, and then change the way our hospitals look. So if you ever get a chance, it's the Complex Care Center. One of the good things about it is that it's so spacious. So, like, I fit in there, my wheelchair fits in there, and whoever I bring in there fits. And I get weighed. I hadn't gotten weighed in like 5 years prior to going there. So, like, those are things that matter. And then also, if you look like you know what you're talking about, if I don't feel like an alien to you, then I'm more prone to come back to you. Because most of the time, I'm explaining to doctors what cerebral palsy is versus them telling me how it could. And then we also need to look at, like, the research side. So statistically, like, speaking, researchers can kind of tell you where your body's gonna go in 5 years. No one can tell me where my body's gonna be in 5 years. No one can tell me what to expect. Even now, like, as much pain that I'm in, no one told me at 19, like, yo, when you hit 28, like, things are gonna get harder for you. Your joints are gonna hurt this much, and no one could tell me, like, the progression of my body. But we have a general standard of how people's bodies are gonna go. Why isn't there one for me?
Let's look at the Rochester community. Where are we progressing in the right direction in terms of addressing these barriers, and where do we still have room to make change?
Well, JD mentioned the Complex Care Center at the University of Rochester Medical Center, and that is a wonderful move in the right direction. We haven't talked a lot about the transition from pediatric to adult health care, but those issues are huge. And you can go there if you're lucky, like JD, but there's a very long waiting list. They can't possibly meet the needs of everyone with not just disabilities, but complex chronic health care needs. And so we need to train the larger population of healthcare providers. We need to train people with disabilities to have better health literacy. And there are the bigger issues of poverty and the marginalization of people with disabilities, as well as the even bigger problem of having a disability and being a person of color.
Yeah. Much more that we're out of time for now, but much more that we can talk about. And I hope that you'll both join me again so we can continue this conversation. So a huge thank you to my guests for joining me and for taking the time to explain where we are in our community right now and where we need to go in relation to this issue. And you can learn more about the Strong Center for Developmental Disabilities and programs and resources available to you and our community. Just go to our website, wxxinews.org, and click on the Need to Know link.